Hi, my name is Sarah and I'm the student nurse today. I will be performing a focused assessment focused on a 10-year-old boy who has had persistent asthma. Yeah, he has persistent asthma, but he came here for shortness of breath due to asthma exacerbation. But I will be doing a focused assessment on his lungs and respiratory system. So first, before going in his room, I'm going to review over his provider's orders, facility policy, patient history, any medications he's on that he recently took, any allergies, past vital signs, and the trends. And then I will grab my supplies. So my pen light and my stethoscope, and then I'll head right in. Knock, knock.
Come in.
Hi, my name is Sarah. My name is Sarah. I'm just gonna sit down. So, before I actually have any patient interaction with him, I will wash my hands. I will close the curtain for privacy, and I will maintain patient confidentiality through this whole thing. So, hi, I'm Sarah again.
Hi.
Can I have your name?
Derek Johnson.
Okay, Jared Johnson.
Sure.
And can I have your birthday?
January 2nd, 2011.
Okay, and I'm just gonna check his armband for verification, and everything seems to match up with the MAR and his MRN number. So I'm gonna get 2 identifications. So after just sitting down at his eye level, which just makes it more comfortable for him, I could even start by asking him some personal questions. Since he is 10, he maybe is still a little bit shy. I heard you like soccer.
Yeah!
Oh, that's amazing. I love soccer too.
Oh my gosh.
I know. Do you like
I like to watch it. I like to play it.
Awesome. That's
all of
so
it.
cool, Jared. You must be so good.
I am.
Aw. Aw, that's so sweet of you. I wish I could see you play one day. But anyways, after just getting comfortable with him, I could perform my assessment. So, when you first come into a patient's room, you just always want to assess how they look. See if they're in any respiratory distress, or if they're struggling to breathe, if they're in pain, if they show grimacing to their face. That means that they may be in pain, and even with kids, they may even just, with pediatrics, they might just move still. They don't want to move around because they are in a lot of pain. But I'm just assessing his respiratory. So if I see any rib retractions, if I see any just any signs that he is not breathing well, I would intervene right away. But after that, I see that he's not in any respiratory distress. I'm not hearing any wheezing sounds, which would be common in asthma. I could just ask him a few questions. Jared, I'm going to ask you a few silly questions. Is that okay with you?
Okay.
Okay. So, can I have your name and last name?
Jared Johnson.
And do you know where you are right now?
We are in San Diego.
Good. At the hospital?
At the hospital,
Okay.
because I was having some problems breathing.
Good. And do you know who the president is right now?
Trump.
Okay, cool. So, after assessing, I could tell that he's alert and oriented ×4. Assessing and asking questions is a good way to see their level of consciousness, which indicates that he does have good perfusion to his brain and that he's not confused or showing any signs of confusion right now. So, after that, I'm going to be just assessing his lungs, and just with my eyes, not touching him yet, I could assess his inspiratory and expiratory phases by just simply observing his breathing pattern. And I'm just seeing that he's breathing in and out, and it looks really good right now. And I could also touch and palpate his skin if he's feeling, which I won't, not yet. I won't. So I'm just going to be assessing if he's diaphoretic, sweating, if he has a temperature going on, which means that he could have an infection. And I want to make sure that I do a head-to-toe assessment, take off his gown, or just look while providing patient privacy and dignity. and just making sure that there's no signs of skin breakdown or there's no signs of child abuse. If there's any bruises or fractures that maybe somebody has missed from before, I would just want to do a head to toe quick look at everything that's going on with his integumentary system. So after that, I'm going to start my assessment. So since you are of school age, I will just start with your head, but if he is not of school age, I would start probably with his chest or anything that isn't too invasive to him. So Jared, can I look into your eyes?
Yes.
Okay. So I'm going to use, this is called the pen light. Okay. So Jared, let me just look forward for me. I'm just going to shine this in your eyes. Okay. And then I'm going to pull down your eyelids and look inside them. And then open your mouth for me. Okay, good. So when you assess using the pen light in their eyes, you could, pupils, you want to see them, they're equally round and reactive to light, which means that they will constrict when light is on them. And then you want to ask for accommodation. So go ahead and look up at the ceiling and then just look down here. Okay, and then look away. And then just look here again. Okay, and then look here, sorry. Okay, good. So I saw that his eyes are accommodating and they are focusing on the object when it is far and when it's away from them. So his eyes do focus to and they accommodate to where the pen light will be. So after that, after assessing his face, and his neurological assessment of his eyes and his mucous membranes, through the mucous membranes you could tell if he's hydrated, if they're dry, that means he may be dehydrated, and if they're pale and pallor and bluish, that may indicate that he is not getting enough oxygen, and especially since he is an African American boy, a good sign to tell if they are, if African Americans are cyanotic is through their mucous membranes, because it is a little bit harder to tell with their skin. So after that, I'm just going to assess his lungs and his heart. All right, Jared, so I'm going to have to get a little close to you for this part, okay?
Okay.
I'm just going to listen to your heart.
Okay.
So I'm going to start at the left mid-clavicular and go down to the 5th intercostal space, which is where his point of maximal impulse is, which is where you'll hear the heart the best. And I'm going to lift up his shirt for this. And I'm going to listen for a full minute. And normal limits for a child his age, for a 10-year-old, would be 60 to 110 beats per minute. After listening to that for a full minute, I will then listen to the 4 other cardiac landmarks. So I'm going to start in the right side of the sternum, left, so the aortic, pulmonic, Erb's point, tricuspid, and back to the mitral. And I will listen for S1 and S2 sounds, and I will note if there's any signs of murmurs if I hear them. Then I will assess and I want to auscultate first his lung sounds in all 10 fields. So go ahead, every time the stethoscope touches you, go ahead and take a big deep breath in and out for me, okay? You're fine. I'm going to get all the way to the sides, to the base of the lungs. Okay? And then I'm going to assess your back. Same thing. 10 landmarks. Okay? And I will note if there are any adventitious lung sounds. If there's any wheezing or whistles, like a weird whistling noise, that may be due to airway constriction. And I would put that in the chart, which may be linked to his asthma. So after that, I'm just going to palpate his chest making sure that there's no lumps, no bruises. And then I'm going to also assess for any barrel chest, which means his lungs are hyperinflated due to maybe emphysema or due to his history of asthma. But after assessing his chest and listening to his heart sounds, I want to listen to his abdomen. Jared, is it okay if I just take a look at your belly?
Okay.
Okay. I'm just going to take a look, and then after that, I'm going to palpate it. But before I palpate, I actually want to listen to it. So I'm going to start the right lower quadrant. And I'm going to listen for at least 20 to 30 seconds in all 4 quadrants. So it sounds perfect. You have a great belly. So his bowel sounds were normal. They weren't hyperactive or hypoactive at all. So after auscultating, I want to percuss and palpate. So I could percuss by just gently rubbing it in all 4 quadrants, assessing his face for any grimacing, which may indicate pain. And then I want to percuss. And also, I forgot to percuss his lungs. So I'm just going to percuss his abdomen right now. Just hearing for sounds of dullness or hyperresonance. And then if I do, I would chart that. And then I'm going to also palpate his lungs, which I forgot to do earlier. So palpating his lungs, you may hear hyperresonance, which may mean that his lungs are hyperinflated. But now that I've listened to his heart, listened to his lungs from the front and the back, palpated, assessed for any abnormalities, I could move on to his extremities. So Jared, I want to see how strong you are.
Okay.
You seem like a really strong boy to me.
Yeah.
Go ahead and give my fingers a squeeze.
Oh!
So strong. Good. Now push against me.
Oh!
Pull me closer to you.
Oh!
Good. And then I'm just going to feel your pulses. Hopefully your pulses are just as strong. Okay. So the pulse is strong, has a good rhythm rate. Good. Which means that he has good perfusion throughout his extremities. And I'm just going to go ahead and pinch down on his nail bed. That's called a cap refill, and it sees how well the blood is able to return back into his nail bed after squeezing it. Okay, looks perfect to me. Thank you. So, after that, I am going to do the same thing but to your legs, okay?
Okay.
Oh, perfect. Your legs are looking great. There's no signs of bruises. There's no edema or swelling in them. I'm just going to put my fingers and feel for some pulses, okay? All right. I'm going to feel for the dorsalis pedis. And I'm going to feel for the posterior tibialis. And I'm going to note if pulses are strong, equal, and bilateral. And then I'm also going to push down, noting any edema, which may be due to any cardiac defects or any heart failure that the patient may have. But Jared looks great. He's young. He's 10 years old. And then I'm going to also do cap refill, but for his toes. The same exact thing, but for his toes. Jared, I was just wondering if you were feeling any tingling, any signs of tingling numbness in any of your fingers or your feet?
No.
Okay, good. Perfect. Thank you. All right, Jared. Well, thank you for letting me do an assessment. I don't think I forgot anything because respiratory rate is normal, within normal limits. And your heart rate was also really good. It looks like you're not in any respiratory distress. But let me just make sure what a 10-year-old's respiratory rate is, just to make sure. I think I forgot. Hold on.
Shouldn't it be like 18 to 20? 16 to 20 is an adult.
Okay, I looked into my hospital's numbers, and your age would be, your respiratory rate will be 15 to 30. And I assessed you and I counted your respiratory rate for a good minute, and it looks like everything is normal. Your respiratory rate was 25. And then your heart rate was perfect at 85. I didn't take your blood pressure, but I could always do that later. It wasn't required in there. So everything is good when it comes to your heart rate and when it comes to your respiratory rate.
Thank you so much.
Of course. So after just doing my full-on head-to-toe assessment, I'm going to make sure that Jared has his call light bell, and I will make sure the bed is low with the bed alarm on, and I will make sure that he's doing okay and he's not in any respiratory distress. I will do hand hygiene on the way out, so I'll wash my hands. And I will also just be providing patient confidentiality. I'm not going to tell anybody you are here. It's a secret.
Our little secret.
Our little secret.
Perfect, thank you.
So, just let me know if you need anything, okay? And I'll bring your mom in. Do you want her right now?
Yeah.
Okay, I'll bring her in. I think she's grabbing some food. Don't worry, Jared. You're going to be okay?
Thanks, Sarah.
Yeah. All right. Well, let me know if you need anything, okay?
All right.
All right. Bye. Thank you for watching.